My name is Caitlin Preston. I have 3 kids. So my son is 2 years old almost. He'll be 2 in December. And then my twins are 4 months old now. My husband is great, 3 kids in 3 years. Life is exciting for sure. I had a traumatic first C-section experience. Still to this day, I struggle with looking back on my son Noah's birth. I still have a hard time of actually seeing his birth as a birth. I still see it as a surgery. I get birth plans a lot of time don't go as planned. Birth is very unpredictable. I understand that. A lot of the things that are in birth plans is this is how I would like for it to go, but also here's my underlying medical things to keep in mind. And a lot of that was ignored. I wanted to feel like I was a birthing parent. I was a mother. I did not feel that with my first son. But with the twins, I felt like I'm a mom and I gave birth to these babies. My new doctor with the twins was Dr. Ertl. My husband and I, due to our past birth experience, we came prepared. We had a full list, on both of our phones, of questions of what do you do if this happens? What do you do if this happens? She is a twin mother herself, so she related a lot to me of, I know what you're going through, I know what you're experiencing. So she was able to help calm a lot of my nerves. She took it very seriously how I was feeling, and she was like, I want to help you avoid postpartum depression, even during this pregnancy, but especially after the twins' birth. So if you're okay with it, let's get you plugged into counseling here. She really made sure that I was a person that was being seen for who I am and what all my needs were. Everybody in the room, I could tell, was prepped of, they knew about my first birth experience, and so they were really excited about meeting the twins and helping me to have a more positive birth experience for the C-section. And they did it flawlessly. They were able to keep me fully present. They followed all of my wishes. They made sure that I had, for example, a clear drape for the C-section, which was on my birth plan. At one point, Dr. Ertl actually did come into my room and while I was still in labor and said, we just ran out of the clear drapes, but I knew how important this was for you. So when we knew you were coming in, we went ahead and saved one specifically for you. That literally, even right now, I'm getting emotional because that meant the absolute world to me, that I was going to see my twins being born. No matter what, no matter if I was to have a vaginal or if I was to have a C-section, I was going to see my twins be born. Going into the OR, when I had the twins, when it was finally actually time for them to be born, they prepared me even emotionally. She said, okay, we're about to have the first one. Yeah, and she goes, are you ready? Are you ready to be a twin mom? And then when my son was born, because I had boy-girl twins, my son was the first one to come out. She said, he's here, and she held him up, and I had the clear drape, and I actually cried. And that helped me so much to emotionally bond. And I heard his cries. I saw him cry. And then, then it was, okay, here comes the girl. and I cry again over her being born and my first daughter. And they were actually like, congratulations, your first girl. Yes, I had a C-section. Yes, it was the exact same medical procedure. But it was entirely different. And the thing that made all the difference was that emotional availability that was there. Their care emotionally and mentally made all the difference. Going from where I was just treated like a random person that didn't matter. I was just another C-section. I was just another person having a baby. I was just another, my son was just another baby that they were going to cut out of a patient. To coming to Community North and being seen as, my name is Caitlin, and I'm a mom of twins, and these twins are going to be born via a belly birth. Even they called it a belly birth instead of a C-section. They didn't refer to it as a medical term. The big moral of the story is the more you care, the happier your patients are going to be, and then therefore obviously the more patients you're going to see. And you're going to see so much happier patients, not only from the mom, but then the kids too. It really makes a difference. If the mom is more present, if the mom is happy, the kids are going to be happier and healthier too.